Patellofemoral pain is characterised by diffuse pain in and around the front of the knee, and patients often have difficulty pinpointing exactly where the pain is, and that's because it's usually quite deep, and it's actually the articulation between the patella, which is the kneecap, with the femur, which is the thigh bone. So let's have a little look at the anatomy and see what's going on at the patellofemoral joint. So the patellofemoral joint is an articulation between the kneecap here and this groove on the femur. And the job of the patella is to run up and down in that groove there and change the angle of pull of the big quadricep muscles as they come down, encapsulate the kneecap and insert into the tibia. And their job is to extend the knee joint there. So these are the big quadricep muscles. They encapsulate the kneecap and insert onto the tibial tubercle right down there. Now, if left untreated, patellofemoral pain can go on for a long period of time and get worse. So I'm going to show you some biomechanical issues that may lead to patellofemoral joint pain, and we're also going to have a look at some exercises that may get you on your way to resolving it. Patients with patellofemoral pain will often complain of pain after they've been sitting down for a long period of time, for example long journeys. So this could be due to tightness in those quadricep muscles, and then that causes a compressive element at the patellofemoral joint. So one really good exercise to overcome that is with a foam roller. Now you can either use one of these foam rollers with a grid on it, or one of these foam rollers. Either one that you can tolerate will be absolutely fine. So all you do is place the foam roller on a mat and then roll it up and down the full length of the quadricep muscles as much as you can tolerate. One of the other biomechanical factors that can lead to patellofemoral pain is weakness of the quadricep muscles. Now all the quadricep muscles come down, encapsulate the patella before going on to the tibia. Now if one of these muscles is weak, it may well cause an overload as the patella tracks up and down with bending and straightening of the knee joint. And so a really good exercise to strengthen up the quadriceps is at the end of that extension range using a band. So all I do is step into a resistance band like so, and then bend the knee and pull back as I stand up nice and tall. So all I'm getting is that last 30 degrees of extension, which is really important in making sure that we've got a good balance throughout the quadricep muscles. And as I get stronger, I can start to increase the resistance of this band. One of the other biomechanical factors that may lead to patellofemoral pain is actually a dysfunction at the hip joint, but more specifically a particular muscle called the gluteus medius. Now the gluteus medius sits in this fossa here and inserts down onto the outside of the femur, and its job is to stabilise the hip joint and also rotate and abduct the hip joint. Now, if this muscle isn't functioning properly, we may get an unwanted internal rotation at the femur, which then puts an unwanted load at the patellofemoral joint. And it's rather like the femur is moving underneath the patella, which then, as we run or as we load the joint, could start to cause pain. So one of the ways that we can sort this one out is by strengthening up that gluteus medius. So here's a nice exercise to get you on the way to strengthening that muscle up. So laying on your side, the affected side uppermost, and then all you're going to do with your knees bent at 90 degrees is slowly lift up the hip, so we're getting rotation and abduction, and slowly back down again. And lift, hold it there for a couple of seconds, and slowly back down again. And you'll feel that gluteus medius muscle working to take the knee up and rotate the hip joint. This exercise can then be progressed by using a band between the knees to get some resistance in. Patellofemoral pain can also be as a result of our foot biomechanics. Now, when we're walking, as we heel strike, these bones here become a mobile adapter and the foot actually pronates. As we put our weight over the foot, these bones then start to become rigid and lock up, and the plantar fascia becomes nice and tight in order for us to propel into the next step. Now, if that supination is delayed, or if we overpronate, this can also cause an unwanted movement at the tibia, which then transfers up towards the patellofemoral joint, which may be a contributing factor to getting knee pain. So now I'm going to show you an exercise that we can do to try and strengthen up the muscles, including the plantar fascia, in order to try and prevent that from occurring. So we need a band, and all we do is put the band, step into the band like that, and then you're going to allow the foot to drop down and then lift up that medial arch and slowly back down again there, whilst fully weight bearing through the joint. Although a very subtle movement, you'll be able to feel a lot of the muscles working around the knee and the ankle joint as well.